before we start exercising. So once we need to check ourselves. So if you have an underlying any cardiac conditions, if you are already using any chronic diseases like diabetes, hypertension, or asthma, thyroid, any other chronic diseases, if you have, initially you need to get checked with your physician whether you can do the regular exercise or how much intensity of the exercise are you able to do, or if you have any symptoms, if you have any physical symptoms, and chest pain, breathing difficulty, angina at rest, or breathing difficulty while exertional symptoms, any sort of symptoms if you have, first you need to go to a physician, get yourself checked, see if you are having any chronic diseases, and you always need to be assessed, and then your physician will tell you whether you can go ahead with your regular exercises, whether if it's whatever the intensity or whatever the types of exercises you can go through, and physician will definitely help you, guide you through that. And once if they say like you have to go slow pace, or you have to go with the normal intensity exercises and don't go to the intensity, vigorous intensity, and all, you don't go, you reach your target heart rate of this much, if some physicians advises that, please do follow that. That is very important. So most of the deaths, or most of the sudden cardiac deaths what we see, most of the people, they have underlying chronic diseases which may be diagnosed or which may not be which was not diagnosed, and some genetic variants where we can't pick up, but most of the dyslipidemia or chronic diseases or genetic history if we have, or if we have a proper symptoms which the patient has, and someone said like you need to get checked regularly, or maybe once in a year or once in 2 years or something like that, you need to get it checked so that we can prevent such fatal deaths. And if you think of these deaths because of the cardiac problem or something, which who are having this sudden cardiac death, there is only if you take according to the study, there is 0.31 to 2.1 times per 1 lakh 1 lakh people per year. So this is a very small number what we see. So even these small numbers we can prevent by diagnosing the problem, diagnosing the disease, or diagnosing it much before. Some people without having any comorbid conditions, they may have this underlying arrhythmogenic features of heart, some electrical imbalance, electrical disturbance and all. That is also very rare. Generally, we see it very rarely. So it's better you just check at least your basic vitals and initially when you're starting your initial phase of exercise, when you're initially running or doing basic exercises, if you're having any symptoms, please don't ignore those symptoms. Just go and consult a physician, and then at least get evaluated for the basic things. If they advise you some basic investigations, please get it done, and then you can go ahead with your exercise. And at any point of time, at any point of any intensity of exercise, if you feel any symptoms, or if your heart rate is exponentially increasing, or your heart rate is varying, if you're having giddiness, if you're having palpitations, if you're having breathlessness, then like normally when you're doing with some intensity, if you don't have, and it's after some few months, like if you're having the symptoms, please don't exert yourself more than what you are capable of, or what at that point of time. So that will cause this fatal death and sudden events. So what is moderate intense activity? So one way to tell if the exercise you are doing is working, you have to take the talk test. What is talk test? Moderate intensity means that you will feel your heart pumping harder when you will still be comfortable enough to hold a conversation. So that is moderate intensity. So that is top test. When you can do that, then you can think, okay, that my moderate intensity activity, I reached that moderate intensity activity, and I'm able to go ahead. Like I can still do more than this. If you want to, moderate intensity activity is normally enough for most of the general population. Only the vigorous intensity and all, when people who wants to go, who are athletes, or who wants to have that intense exercise capacity or capability, they go to that vigorous intensity activity. But moderate intensity is where we need to draw a line. So if you find you are too breathless to talk, then it may be time to slow down. If you are able to sing or whistle, then set up the pace if you want to continue with moderate intensity. So this is a chart where you can, this side you can see the age limits, and whether if it's low intensity, moderate intensity, aerobic zone, vigorous intensity, maximum intensity. These are the heart rate variations where you can generally reach. If you want to have this moderate intensity, you can go till this, like if you are around 30 years. So if you want to be a moderate if you want to go to that moderate intensity exercise or workout, you can target your heart rate around 110 to 128. So these are the different intensity, age-wise intensity heart rates where you need to target. But don't focus that it's okay, I can do this at this point of time, I can go to a vigorous intensity and all. But you need to go from one phase to other phase. You shouldn't, like we see a lot of people who does gym, they do heavy weights, they do deadlifts and all these things. We think like, okay, let's do in 1 week time, let's do that and all. But it's that your body needs to get stabilized slowly. The intensity, when you start initiate your low intensity exercises, then it will take some time to go to moderate or vigorous or maximum intensity exercises. So the pacing your body to that limit, like vigorously at the initial phase, that will cause more harm. That will cause, see, whatever intensity you are doing, it everything, the stress will be on your heart. So the increased heart rate, that's what does everything it does to the body. So when you're doing instant vigorous exercise, so it's all the burden on the heart. So we should never do that. So we should pace our exercise. We should divide our exercise into phases, and then we should decide. And one thing, most of the young population, or the people who ask, like how frequently we need to get checked. People mostly, they have to divide. People who are having this any risk factors or any other chronic comorbid conditions or anything, if it's under control, if everything is stable, at least once a year we suggest. People who doesn't have any comorbid conditions, at least once alternate years, once in 2 years, it will help for you to get diagnosed if anything is abnormal. And people who takes medications, who needs a very good control of the, if you take hypertension or diabetes, or people who are already having the cardiac diseases, when we are doing the rehabilitation, first initial rehab phase is one thing where you need to get checked regularly. Once you reach that phase, if you reach that walking test, the 6 minutes walk test, or based on your heart pumping capacity or any other comorbid conditions where it limits your working capacity or exercise capacity, so you need to get checked regularly. Once you reach that phase, so that you can regularly monitor and do once in 6 months or 1 year. So that will help you to diagnose if any abnormality and prevent such like fatal incidents.